semester fellows, masters, and guests. Well, timing actually is very, very relevant for this topic, being healthcare. Venti, please. Maybe you might recall, like, if you've been to Starbucks, the Starbucks experience, you order your drink, and sometimes maybe you want to customize it. Soy, whatever, latte, plain coffee. You get customized drinks, satisfactory outcome, personal service, and it's pretty quick. You know, compared to healthcare, which you might have experienced this type of experience where you're not really experiencing that happy feeling of getting delivery service. You go to the building to wait for a doctor or to wait for a prescription. And so it seems really far-fetched to think that healthcare could go from what it is today to something that's more customer-centric. But actually, it might not be a pipe dream after all. So on November 6, 2015, there was a Capitol Hill briefing titled Transforming Healthcare to Drive Value, which is amazing. It brought together top healthcare leaders from diverse business and policy expertise. They shared their perspectives on Medicare, Medicaid, what industry is doing, the payments, the payers. And so I'm going to just describe to you is what 3 ways that I understand that healthcare is going to be improving in the future based on this briefing. So first, payments are increasingly provided based upon performance versus what currently is a pay for service. So as an illustration of this fee for service, a person goes into a hospital for whatever reason. The hospital gets paid. The patient catches a disease while they're in the hospital, and then the hospital still gets paid. And then the patient goes home, thinking that's done. They're done with this experience, and then they get a complication, and then they go to the hospital, and the hospital gets paid yet again. This sends the wrong message as it rewards the hospital for sickness, not for health care. If we want health, it makes sense that payments should be based on total health outcome and not just for showing up and needing health care. So, for example, Health and Human Services are responsible for Medicare and Medicaid has set goals for fee for service to go from 0%. Fee for service just by itself to go from 0% provider accountability for quality and total cost of care to 50% by 2018. And most of the remainder will be linked to value or quality at least by 2018. So they've actually seen a lot of improvement in that area. There's another payment issue, that of public versus private. So when I talk about Medicare, Medicaid, these goals that they've set, that's just government. So what they're going to do is they're going to align those payments so it's actually more aligned. They're actually more alike from the public and the private. Massachusetts, for example, Blue Cross is a majority insurer. There is actually seen cost and quality improvements due to contract changes from 1 year to 5 years. That means that instead of negotiating every year, different insurances negotiating different prices, and they've decided that they were going to partner with the hospital and give a fixed amount for 5 years, and so they've actually focused and partnered on delivering better care, and they've actually seen that by investing in a patient's total care rather than a fee for service, they've actually been able to prevent a lot of these issues and health issues. So the second thing that's coming, improvement with payment models, is to more models themselves, like the delivery. Like, you've got, coffee trucks, or you're going to have better delivery models with medical care. So that'll enable people to spend less time waiting for service and for the information about their health. So for example, there's a private insurer named Guidewell in Florida Blue, which serves 15 million people across 14 states. And they've actually created resale stores where you can meet reps face-to-face